I will call the meeting of the Regional Transit Partnership to order on Thursday, September the 22nd. Welcome, everybody. Our first item of business is to invite Katie Miller from VRPT to join us electronically. Katie's on Zoom. So I would entertain, Katie, I would entertain a motion to admit Katie to our meeting.
So moved.
So we have a motion for Brian, a second. Great, that's all right. If you would please call the vote.
Supervisor McKeel.
Yes.
Counselor Pinkston.
Yes.
Counselor Oshram.
Yes.
Supervisor Pruitt.
Aye.
Director Parker.
Yes.
Director Silsdorf.
Yes.
And that's everybody.
And I'm going to back up a minute because Katie, I forgot to ask you to give us your location. So would you please just give us your location and your reason for Zooming?
Yep. I am in the DRPT office in Richmond, Virginia, and there were no state cars available, so I didn't have a way to get to Charlottesville, unfortunately, today.
Well, welcome. And I assume the order is okay, Lucinda, even though I missed the order a little bit, but we're good. All right. With that, let's do our normal introductions. Peter, could we start with you, please?
I'm Peter Krebs from the Piedmont Environmental Council.
Yes.
I'm Randy Parker. I'm the Louisa rural representative on the board.
Welcome, Randy.
Thank you.
I am not Mike Murphy, but I'm Jason Espy, Senior Director of Planning at JAUNT, so I'm filling in for you either way.
Welcome, Jason. Mike told us he was going to be on a trip for this meeting, so we're hoping he's having a good time.
He's having a good time. There's no hurricanes around him. He's on the beach somewhere.
There you go. That's excellent. Ben?
Ben Chambers, I'm the city's transportation planning manager.
Scott Solsworth, I'm the Director of Parking and Transportation at UVA.
Brian Kingston, member of Charlottesville City Council.
Diana McKeel, member of Albemarle County Board of Supervisors.
Natalie Oshram, Charlottesville City Council.
Mike Pruitt, Albemarle County Board of Supervisors.
Christine Jacobs, Thomas Jefferson Planning District Commission.
Jen Fleischer, Blue Ridge Health District, sitting in for Peter Thompson for Charlottesville Area Alliance.
I'm Sarah Richardson, and I work for PATH Transportation Program.
Welcome.
Thank you.
Lucinda Shannon. I work for TJPDC and staff this committee.
And Katie, you want to just introduce yourself?
Katie Miller with the Virginia Department of Rail and Public Transportation.
All right, and Gretchen Thomas, TJPDC. All right, and Garland, would you introduce yourself, please?
Garland Williams, Director of Charlottesville Air Transit.
And
Jessica Fish-Valerie, Albemarle County Community Development.
great to see you, Jessica. All right. Introductions, announcements. I don't think we have any announcements that I know of today to get started. So our first action item really is approval of the agenda. I would entertain a motion to approve the agenda.
I move for approval of the agenda.
Brian's made a motion.
Second.
Second from Natalie. Would you please call for the vote?
Supervisor McKeel.
Yes?
Counselor Pinkston.
Yes.
Counselor Oshram.
Yes.
Supervisor Pruitt.
Aye.
Director Parker.
Yes.
Director Silsdorf.
Yes.
And, Katie doesn't vote. She does vote. Miss Miller.
Yes.
There you go. All right, so that's everybody, Lucinda? All right. We also have the meeting minutes in our packet from August the 22nd. So we'll need to approve these minutes.
So moved.
So moved, so Mike has made a motion, and Scott seconded. Does anybody, though, quickly, just let me ask, did anybody find anything that they wanted to, any edits or changes? Everything is okay, 2 minutes? Just want to make sure. All right, so we have a motion and a second. Would you please call for the vote?
Supervisor McKeel.
Yes.
Counselor Pinkston.
Yes.
Counselor Oshram.
Yes.
Supervisor Pruitt.
Aye.
Director Parker.
Yes.
Miss Miller.
Yes.
Director Silsdorf.
Yes.
And that's all.
All right, so we have an agenda, we have our meeting minutes approved. Do we have anyone signed up from the public today?
If there's anybody in the room or online who would wish to speak as a member of the public, please use the raise your hand function. I don't think there's anyone in the room. And I don't see anyone.
Signed up.
Yeah.
Okay, all right. The first agenda item is the remote meeting policy update, which most of us are aware of that the General Assembly made a few changes. So this is our chance to review. So I'm going to turn it over to Christine for this.
Great. So legislation adopted by the General Assembly necessitates some changes to our remote electronic participation and all virtual meetings policy. In your packet is both a staff memo and a copy of the revised policy. The Thomas Jefferson Planning District Commission approved this in their July meeting. Since you all are an advisory body to the commission, you also have to follow that same adopted policy. So I just wanted to detail a couple of those changes to make sure everybody understands. So the changes include the ability to hold all virtual public meetings limited to up to 50%. That was previously 25%. So they've increased the ability for you to hold an all virtual meeting, which means everybody participates online, no in person. For example, if you guys meet 10 times a year, up to 5 of those are permitted to be all virtual. It has to be posted publicly. That'll be held in an all virtual setting. It cannot have, your body cannot have more than 2 consecutive all virtual meetings. You do have to continue to have an in-person quorum at least every other meeting. You have to provide the public access through electronic communication means. We have to be able to give them a way to call into us if virtual communication is disabled so that they can no longer hear the meeting and the meeting would have to go into recession. While we fix that issue, we cannot continue to hold the all virtual meeting if the public cannot access it. And then there's a couple expanded provisions on the use of video and sound. In order to establish quorum in an all virtual meeting, cameras and sound have to be available. Anytime the camera is turned off, you are considered absent during that portion of the meeting. Any votes that are taken, you have to be able to be seen and heard when it's an all virtual meeting. The other provision in there is that it now requires an annual adoption policy, not just as changes are made. So you guys, this will come before the body every year, assuming that the RTP is still around in a year. And then finally, this is just informational. You guys don't have to take any action on this because it is a policy of the PDC. Happy to take any questions.
You went through that very efficiently, but I will ask if anybody has any questions. We did have the policies in our packet, but does anyone have any questions? No? Everybody's good? All right.
I'll just add this because I know there's some, sorry to interrupt you,
Yeah.
There's some confusion sometimes. There were not changes to, if there is an in-person meeting with a quorum in person, the way that people can participate electronically, that did not change. That is still up to 25% for the same reasons, illness, personal matter, up to 60 miles, all of that remained the same. This is only if a meeting is now all virtual. Forgot that.
All right. So with that, we'll move on to Charlottesville area.
Can I ask you a question?
Absolutely.
Is it safe to say that our sort of default is going to be to continue to meet in person? I hope
Yeah.
so.
That's fine, yeah. We haven't discussed. I think most of us are close enough.
Yeah.
And there are advantages to meeting in person.
Well, I think it's the best way to do things. I wondered if at the level of the PDC, Christine, if there's any sort of, are people saying, oh yeah, we should try to bake in doing a meeting recording virtually, or?
Yeah, we
I
take,
find it hard to keep up with that.
Sure.
Like,
Yeah.
playing around it.
we take direction of the individual bodies. The commission itself is considering some virtual because they're traveling from all 6 jurisdictions. So most of our urban-centric meetings, folks are still very happy to be in person, but for those that are already traveling 60 miles, they are requesting that we have some rotation of in-person and virtual.
And it is nice that Katie from Richmond can join us when she can't get here, so that works very well for us. All right, so, we're gonna have a report now, presentation on the Charlottesville Area Alliance Walk Audit. I think this was postponed from the last meeting, and maybe from one other meeting, it seems like to me, but, so we really appreciate your patience, and with that, Jen, I'll leave it to you.
Thank you. So I'm reporting out for Charlottesville Area Alliance, and they partnered with AARP and America Walks to host a walk audit workshop. It was back in July. The CA Transportation Work Group got a technical grant from AARP for livable communities. And so the grant was put into action to host this walk audit and bring community and government agencies together and organizations and non-governmental agencies into the planning fold. And the questions they were trying to answer is, what is truly accessible when it comes to walkability, and what is important to this group and to walkers, folks, pedestrians in general. There were 34 attendees from nonprofit, governmental, and community agencies, and it kind of had a threefold mission. Educate, assess, and evaluate the nearby walkability and accessibility of the area we chose, including access to transit in that area. A train the trainer kind of section of the walkability audit. That goal to make it a more sustainable effort, so this wouldn't be a one and done, that we could actually complete this with other community members and neighborhoods further on. And then design solutions that work for everyone. So with that sustainability, any solutions that came from the walkability audit could be replicated for all walkers and rollers and mobility in general. So the vision for this walk audit was investment in infrastructure will, with thoughtful and inclusive planning, enhance opportunities in underserved Charlottesville and Albemarle neighborhoods by providing better connected walkability and transit, leading to improvements in community health and access for all. And so this audit and training centered on equity the vision was to strengthen partnerships and then generate ideas based on what we saw when we did the walking piece of this, or the pedestrian piece of this, and then establish foundations for the future. So going in, all 34 groups that attended were really keeping these 4 pieces of the vision in mind. And that's VDOT. They're just VDOT was one of them. So we did the walk audit. It was, again, up on 29 on Hillsdale, and these are just some of the results I pulled from. There was a survey that was done during the walk audit, and there was discussion. So I've compiled this from CAA. So which part of the walk audit route was most walkable? It was Hillsdale because it was even, wide, and smooth space. And then another question was describe 1 or 2 locations which were not walkable. Along 29 North, the sidewalk is not rollable. It's cracked and slanted. The curb slopes were too steep. Now, this language comes from a VDOT participant, because I don't know this language myself. Minimal buffer, pedestrian head timing too short, and high-speed traffic. So, I mean, now I know what those things mean, but when this was written, I did not. So, that was to say that, okay, VDOT was also on the adventure with us and recognized that these things were an issue. And we chose this area because it was city and county and VDOT. Everyone had a hand in it. Everyone had a share in this geography, in this physical location. So it made it good.
What is pedestrian head timing?
It's how long it takes to get across the street with the walk signal. Did I describe that right?
Yes.
With more excitement than most people do. Because
And a minimal buffer is just you're right on the road?
Right on the road, yeah. If you tripped and fell, that would be not good. Yeah, that's what minimal buffer is.
So could you go back
Yes.
just a minute? So tell me what pedestrian head timing too short.
That's the time between, so when the light says
Which
change.
one?
Oh, say again?
Which one?
Oh, pedestrian high timing too short along 29, like physically where that is or
I
what?
wonder what that actually means, head timing too
Oh.
short. Is that getting across?
Yeah, that from it changing to white walk sign to blinking numbers to stop, that timing is too short. You can't actually get across before it stops you. Yeah.
All right. So an adjustment in the timing was necessary.
Yeah, that it was too short to accommodate the majority of walkers. Almost all of us didn't have any mobility issues, so it left no room for error for anyone else.
And just for clarity, when I'm looking at the map, that whole area is in the city.
Is that true?
So the only corner of that intersection, of that hydraulic intersection that's in the county is the Stonefield intersection.
Yeah,
Stonefield corner.
we had planned on like crossing and going into Stonefield,
Uh-huh.
but we couldn't get across 29, so we weren't able to go over to the Albemarle side.
Which says a lot, doesn't it? That really says a lot. Having said that, once the city and the county finally when we get the pedestrian bridge built, this will open up this whole intersection much better for pedestrians. But just to let you know that all of that I'm looking at right now, where you were walking, is in the city.
Is in the city.
Yeah, just so everybody knows.
No, that's good. Thank you for that correction.
Most people don't realize that intersection, the only corner of that intersection that's in the county is the Stonefield.
Got it. Thank you for that clarity. That's good.
So it'd be interesting too, because that's changed now, because this was before the traffic circle.
Right, we weren't really.
It was under construction.
It wasn't, yeah, it was under construction. We were close to that, but we weren't in that zone yet. We were kind of just north of that new roundabout.
And then maybe the construction probably didn't help either. Did that, you weren't really near the construction that you said it was.
No, there were parts that we traversed that were under construction, or I can think of that black tar part that had just been constructed, but we weren't in the heart of the roundabout being built at that point. Yeah.
And I didn't mean to interrupt you, but I want, while you have that now.
No, I'm glad, thank you, that's helpful.
And I really do appreciate Natalie was with the group, I think.
Yes.
So we have one person, Peter, were you part of this?
Yeah,
So
Peter
we have
was
two
there.
people.
Ben was there, Jason was there, yeah.
Look at this.
Lou was there.
This is great.
Oh, yeah.
All right.
Yeah, Mike.
I saw one of the things was about the grade of the curb cuts,
Oh, yeah.
which surprised me because I might have assumed that there was like a VDOT standard that everyone had to use.
It is surprising that VDOT called that out, and there is, as far as I know, a VDOT standard that's meant to be used.
I think what, like, the infrastructure, part of the infrastructure that we were looking at was old, so it was not up to code, it wasn't up to those standards. That's why Hillsdale Drive was really nice for pedestrians, because that is newer and it's up to the codes.
And the other thing too is that was all in the city. So while the city takes care of their own roads, right? So VDOT was there,
Right.
but you see VDOT has given the city permission to take care of their roads in the city. It's very confusing.
I don't know if we take care of the sidewalks on 29.
Yeah.
I'm not sure.
That's one I have to look into.
Yeah, but I'm just saying that for the most part.
Yeah.
But I would be willing to bet that the codes have changed a lot over the time that those ramps were built.
Embarrassing knowledge gap, but I'm correct in you are still using VDOT's design standards when you're implementing your own.
Yeah, we have our own design standards in the city, but they do have to conform with things like ADA, ROAC.
Okay.
I believe that hydraulic road though is managed by VDOT. I think there was some discussion about that or partially. I know that the
decision was when we were doing all of the work around that intersection, it was a VDOT and an Albemarle and Charlottesville endeavor. So the three localities were working on this intersection and the roundabout. Jason, I think maybe that's what you're referring to.
I was just talking to the VDOT folks there. It is a complex sort of patchwork.
Yeah.
Yeah, that's why I think I'm with Ben and you on that my conversation with VDOT was more about the sidewalk itself. And I think that did fall under some jurisdiction, but was very outdated. So we can follow up on that.
If you're talking about the sidewalk that's along 29, that's coming north-south there, then I would say, yeah, it's probably quite old.
Yeah.
Not surprising just because of the code. It may not have met code when they first built it, which is not good, but.
Because I called the other day, I called VDOT about a question about just right over on the bypass, right in that area. And because I assumed that the 29 bypass was VDOT. And she said, oh no, that's the city. You need to call the city. It's very confusing.
Fascinating. Yeah, we picked a really good spot to have this very unclear walk on.
Very interesting.
But that, I mean, this picture you're seeing was VDOT showing us the new improvements to come. And they kind of ran through that. But we talked about what could improve walkability. So the overarching kind of theme that came out of those results was design infrastructure with people, not cars in mind. And that would look like wider walkways, vigilant maintenance. That was really a piece of this that came to light because we had someone in a mobility device and we had 2 wheelchairs that we used to roll and test out rollability. The maintenance became even more clear to those of us doing this path. Adding shade came up a lot. Mixed use path, it's quite narrow, the sidewalk that's here, again, old and narrow. If you had a child in a stroller, an adult and another adult, there would be a standoff and someone's ending up in the grass. So that was kind of mixed use in all kinds of ways that can be applied. Bigger buffers, slow down traffic, and then make sure that sidewalks are for all of those users. Now,
one of the other maintenance things that someone pointed out that I was like, oh yeah, that too, was some of the trees were hanging low. So if you were visually impaired, you clocked yourself on some of the branches. So that was another, like, it's not just the roadway, it's also above. That's part of the accessibility. Because we would all just duck, but then you realize we can see where we're going.
Absolutely. Or you didn't duck and just hit your head on it, which is what I did. So yeah, it was, that maintenance has a broad swath of the vigilant maintenance. Moving as a pedestrian, so these were takeaways. I love the picture of Peter.
Right, Peter picture.
So all of us took you could kind of take turns in the wheelchair, and it was I thought it was so revealing. But moving as a pedestrian is hard, but in a mobility device is way harder. And it was striking how much more time consuming and difficult it is to take transit on a wheelchair. So we all caught a bus and took it up halfway around this loop and then walked the rest of the way. So we had at least one mobility device for the bus, and then one other wheelchair, usually with someone in the wheelchair, so that we could see kind of what it's like to get on the bus, how to position that person on the bus. And to be fair, if I was a driver, it's probably something that takes practice. Because you're using another bit of technology as the driver. You're lowering the ramp, you're locking the person in. Plus we were a gaggle of 20 people all at once. So some of the groups had different experiences from others. Some got on easily and some did not. So that was, again, an eye-opening experience about the transit in a wheelchair in particular. Just because the sidewalk isn't rollable. And then this part about the maintenance with the trees and also adding more trees, the lack of shade was very clear to us. Remember, this is July, so we were like on 29 in getting blasted, and that's not going to get any better. And then the bus system is clear. Like we were with, in my group in particular, we were with an everyday rider who was in our group. And he had, before we even left the building, he had the app up and could tell us when the bus was coming. But if you're a frequent rider, that's great. But if you're not, there are barriers to being a new rider. It would not be clear to you that those options that he had through the technology were available if you just walked out of the hotel as a guest and were looking for a bus stop. So that was, in this location, what was some of the takeaways. And then moving into next steps, like what do we do with all of this information? So there is a move to consult neighborhood leaders and associations to, again, train the trainer to do their own walk audit. Support city and county initiatives that are already doing walk audit efforts. We know Ben's group has, his department has done that before. We know that that's happened in the county. Keep community members connected to that walkability work. So in the literature from AARP, in the past, government agencies have done walk audits with their staff. And this recommendation is grab folks from the neighborhoods you're going to impact, also who have strollers and mobility needs, and get the community involved in that walk audit. Make a concerted effort to make it outside of your staff to meet those needs. And then our new PATH program, which you'll hear, the transit field trip and bus buddies pilot. Should I talk about that later?
I'll talk.
Oh, you'll talk about it. Okay, then you'll hear more about that, which is very exciting. I think that's it. Yeah. So I can kind of go back to there. Any questions so far on what you've heard? Even though a lot of you went on this adventure.
Oh, we didn't have a question. Would you go back to the map again?
Yes.
So it's really, I think, behooves us to think about this from the city and the county, because that area that we're talking about right now, from the hydraulic intersection down past what I call Chicken Row and Angus Road,
Did you
that,
call what?
Chicken Row.
well, I call it Chicken Row because of all this, and that's in the city.
The
Chicken Row.
Charlottesville chicken strips, which is cartel terminology.
Yeah, but it's a lot quicker to say Chicken Row. Having said that, when the city, and this gets to Jason's point, when we were, the city and the county and VDOT, when all of the representatives were trying to figure out what we were going to do with that intersection, that dangerous intersection, and we finally settled on the roundabout at Whole Foods and the roundabout at Stonefield and the pedestrian bridge. Part of what that original design was going, what the area that was going to actually be addressed as well was Angus Road and that, what did you call it,
The chicken strip.
the chicken strip, the chicken strip. And so, because Angus Road runs right there by the chicken strip, and the traffic improvements also went across the road, and I've forgotten the name of the hotel that's over there, where you have a road that comes down from the bypass by that hotel. So there were going to be, we had a plan to improve that whole area. We had to pull it out because it came back as so expensive that we couldn't afford the other work. The city and the county of VDOT couldn't afford the other work. So we pulled that out, but VDOT said at the time that they would be coming back to us with a different recommendation for that connection from the bypass and from Chicken Strip and Angus Road. So they're going to be looking at that very area. It would behoove those of us in the room when we're having hearings on it and we're talking about those improvements when they come, to look at some of these recommendations and say, we need more trees, we need better access, we need to reach out to the communities around there, because that will go through a full public process, just like we did with the others. You see where I'm going with this?
Mhm.
Because these recommendations would be very handy during those discussions.
I think so.
Yeah.
Yeah, great. That's it, thank you
There's
so
a
much.
bunch of grocery stores,
Yeah.
right, they're really clustered there, that was quite apparent. And then, yeah, this project,
Low-income housing on the other side.
correct, yeah.
For which people are trying to get to. Right. Yeah, absolutely. Now, the pedestrian bridge that goes across 29 will help a lot, Peter, for connection. And there will be, and I guess Garland could talk about this, but there is supposed to be a pull-in bus stop, a transit stop on the Charlottesville side of that pedestrian bridge.
Correct.
I don't think that's.
There's space there for it, but there's not gonna be a bus stop built into the project.
No, but there is space for it. It's
Right,
already-
we don't have service there today,
Right,
and we
but-
don't have it in our plans for a few years at the very least.
I think it's phase 3.
Okay, right, so we need to keep that in mind though, because that's a great location for a bus stop.
What I hope at some point is if you go further south, that we can have another bridge or some better pedestrian connection between the Meadows, which is this kind of island off to the northwest of the city, behind Best Buy and
Oh, yeah.
all that. So that they can their kids can get over to schools. So I hope that at some point we can build some bridges, or we can do better pedestrian crossings. And we've got something I want to catch up with you and one of the neighborhood leaders there. Yeah, and James Freeze, because
Well, when we were talking about this area, with the original plans of trying, when I'm talking about the construction that's going on now, the Meadows was talked about a lot when we were looking at this area.
wasn't the idea to do at the junction of 29 and hydraulic what happened up at Cryo?
Yeah, and we couldn't, we submitted that through Smart Scale, did not get the funding. We were competing with $3 million tunnel. down in,
Yeah, that would be
Yeah.
a big difference.
it would, but, so what we did, when we couldn't get the funding for that grade separated intersection, we came back and then we parsed it out, and that's how we ended up with the 2 roundabouts and the pedestrian bridge. And we even had to take out the area you're talking about, the improvements to the meadows, Angus Road, and that whole Chicken Row area. Chicken strip, Chicken Row. Because that was part of the plan, and we had even had hearings with the people that live in the meadows at that time. So when VDOT comes back with a proposal, that's the time to jump all over this. Yeah. Good discussion though, I mean.
Clearly, they chose the right intersection, just walk.
They did, because there are real challenges there for folks. And as Peter says, there are grocery stores there that people need to get to.
And there's a lot of growth.
Yeah,
Change.
yeah. Well, we do consider certainly 29 North is a growth area. Yeah, especially going up 29 further, but there are lots of folks here.
Natalie, you went, what did you notice in terms of bicycles and that sort of thing? Did it kind of track the same as the walking?
I mean, biking on 29 is a nightmare. I mean, I try and bike around the city as much as possible, but like biking to Trader Joe's is still a thing I've yet to conquer, but the pedestrian bridge will help with that, so that's something that I was keeping in mind, is like getting to that corner is, I mean, if you cross lower, there's like gaps, it's just like, you can't really do it well. But as for the Hillsdale business, that part all is fine.
But you're right, that for bikes, the pedestrian bridge will help.
Yeah, and by fine, I mean, there's no protected bike lanes, but,
Hillsdale is a shared use path, though, so you ride on the sidewalk.
yeah.
All right, Lucinda, so this is the Path Mobility Management Program.
Yes. So you guys have all probably heard me talk about the mobility management program and the 5310 grant that we received last year. So it's now called PATH, which stands for Partnership for Accessible Transportation. And it's nearing the end of our grant fiscal year, so I wanted to give you all an update on what we've done so far and where we're looking to in the future. So as our population grows, we're gaining more and more elders who will need transportation support. As recognized also by the Blue Ridge Health District's Community Health Improvement Plan, transportation is like one of the #1 barriers to a healthy community for our region. And PATH is working to build coordination among transportation providers and human service agencies to expand and improve transportation for older adults and people with disabilities. So this year has been mostly program startup. We have been working to form partnerships and secure funding for the program. We were able to form an agreement with JABA to host our call-in center, which would provide, it's an information and resource center to providing information about all of the transit options for people. And then we also worked on conducting a marketing study that was funded by UVA, Parking and Transit. And we hired and trained, thank you. We hired and trained transportation counselor, Sarah, and we started marketing our information and referral center. So part of our marketing was we conducted the research and produced the marketing materials that you saw in your packet. We also produced a web page for PATH that has links to all of the transit providers on it. And we really depended on human service agencies and organizations that work with and intersect with older adults and people with disabilities so that we could connect with the non-drivers. And We tabled at events like West Haven Day, handing out flyers and talking with people, giving them out our phone number. We presented to many, many community groups. We covered all the food banks. We worked at the community centers, adult day centers, and other connection points to work with our target audience, handing out materials at all those events. And then some of our efforts even included Blue Ridge Health District sharing a social media post for us and a public service announcement on WNRN. So we're on the radio. So the services that we're offering and we've been marketing is a one-click, one-call information center, which will have information for all the transit options. So if you want to use public transit, you can connect with us or go to our website and we'll help you learn how to ride the bus. We will, we call Sarah a transportation counselor because she'll look at all the options. If you're having difficulty reading the schedule, she'll go through that with you and she'll just really walk people through all of the systems and how to use them. And we haven't been taking calls for very long, but I wanted to share some data that we've collected so far. So we have a really extensive data collection system that I'm pretty excited about. So, I don't know why it looks like that. It should be in color, but we'll just go with it. Most of the callers that called us needed a ride to a specific event, and that mostly was medical appointments. So they, had something next week or in 2 weeks, and they didn't know how to get there, and they were asking for help. And then the second highest type of call was asking general questions about transit and what options are available and how to use them. And Sarah answered them all. Most of our calls, we received calls from all of Region 10. Most of them, we even helped people. The other is people who called from Buckingham County or outside of our Region 10, but we helped them anyways because they were going to a place, their destination was in our region. And you can see from the number of calls, they correspond with population density, with Albemarle and Charlottesville being the most calls are coming from those jurisdictions. The top reason for travel, 84% was to medical appointments. People needed transportation to essential services that they were having difficulty getting to. So I just want to pause and think about, if all the non-drivers in the area, and if they're having difficulty getting to an essential medical service, what else are they missing? What other destinations are they having difficulty getting to or just not going to? So we referred most of our callers to JAUNT, and they've been a terrific partner and a terrific resource for older adults and people with disabilities. We keep a comprehensive list of all the transportation options available, so we always refer first to CAT, and then if that's not working for the person, we'll help them with application for ABA service. We'll walk them through it, and then we'll get them connected with JAUNT. If that's not available, because a lot of our rural communities don't have a lot of options, we have an extensive list of transportation providers, private providers, taxis, Uber, Lyft, just people that we know who provide rides. Sarah will call churches and just, kind of rack her brain, volunteer organizations to see if she can get a ride for people. So that's been really helpful. She also, because she works at JABA, knows a lot of insurance things, and she's been able to talk with insurance companies and be able to get people reimbursed or rides to medical appointments through insurance too, which has been great for people. There's a whole nother part of, and I'm sorry, I don't know how to fix the thing, but there's a whole other part to the PATH program, which is community partnerships and the goal of increasing transportation options for non-drivers. So we're pursuing and enhancing our collaboration among service providers for both transit, human, and medical providers. And we have a lot of partnerships right now that are working really well for us, and we're looking at future partnerships. Some of the projects that we're working on right now, Jen alluded to. So the Charlottesville Area Alliance, which is a group of, like a coalition of providers who work for older adults, and they want to have a livable community. And so they got an AARP Livable Community Grant, and they've been doing a couple projects, and we've been helping with some of them. So one of the things that we're working on in partnership with them is a bus field trip with CAT. And we're going to, our first one is October 8th at Innovage, and I have details on that after my presentation. You all are invited if you'd like to come. And we will have a group of seniors from Innovage. We're going to do a workshop on how to ride the bus, how to read the schedule, all of that. And then we're all going to walk as a group to the bus stop and take the bus to the downtown transit center. Our partner Kat is going to have somebody there speak about the transit center and the safety of it. And, and then we will have lunch at the pavilion and then take the bus back to Innovage and do a little debrief about how their experience was riding the bus. We're also working with the Charlottesville Regional Redevelopment Housing Authority, and we're going to be doing presentations at kind of like transportation workshops for all of their housing sites on how to ride the bus. If they're not able to get to the bus stops for CAT, then we're going to sign them up for JAUNT, and we're going to kind of work with them on helping them find solutions for their transportation needs. And we're also talking with, in the future, volunteer driver programs like Seaville Village, and what we want to do is support them in enhancing their services and increasing the services that they're offering. And one way that we're going to do that is we're applying for funding to be able to reimburse their volunteer drivers so that they are encouraged to go further for appointments and things like that. So we're going to increase the amount of transportation for older adults and seniors and anybody who's a non-driver.
Where is Seaville Village? I'm just not familiar.
So Seaville Village is kind of new, and they just started a volunteer driver program. They cover all of Charlottesville and a mile outside of Charlottesville into Albemarle. And you have to become a member. It's pretty cheap, and then you can use their volunteer services, which one of them is volunteer driving. They have other services too, like fixing your home or I don't know, other things. Sarah knows it all, but yeah. So
what was the date one more time?
October 8th, Alex, we've been working with Alex.
Yeah, I know. I just want to make sure it's when it's counted.
Surprise.
Better be.
Yeah, so the path aims to enhance transit services by providing a centralized phone number and website to connect community members with all available transportation options. We provide coordination and support to improve transportation services, and we have a complex data collection system to frame informed decisions, expansions, and changes in transportation services. We conducted one survey, and we plan on doing one every year, so that will be an ongoing way to collect data. And then using the 5310 grant, we're really an infrastructure and funding foundation for an expandable model that serves multiple stakeholders and programs in the future. So we're not going to be providing transportation, but we're going to be working with providers and helping them and providing support for them. And that is the end of the presentation. We have materials in the back, and if you would take some and share them with people who are non-drivers or maybe thinking about being non-drivers, that would be fabulous. We've been really promoting our materials a lot of different places. So, any questions?
You may have stated this already. What are the absolute number of people that you serve?
Yeah, so I didn't say that because it's embarrassing. We've served 100, had 113 calls. Most of them were for medical, and a lot of them, there were no services available for those people, which is where Sarah really tried hard, you know, calling all different places. She even called a volunteer fire department.
I did.
Yeah.
And that's since the spring?
Yeah, so Sarah was hired in May. We did, we made the partnership with JAVA in September, and they have a hotline, like a senior helpline. And so we did answer those calls for transportation and worked with them. I trained their staff how to answer those types of calls and things, and we met with JAUNT, our staff met together to talk about
This September?
So yeah, it was, you know, from September to May, before Sarah was available. Yeah, so we did count those calls that came in through the hotline, which is just JAVA's general hotline. Most of their calls are for transportation.
So it sounds like there's work to be done in terms of
So-
socializing this and advertising.
Yeah, one of the things that we realized was our model was with Rappahannock, and they don't have CAT and JAUNT and all of the fabulous service providers that we have here, because they're a lot smaller. So they are actually providing the services themselves, and we're not doing that. So they were like, oh, you know, you're gonna get a ton of calls. But unfortunately, because we're not providing any services and people can call JAUNT on their own, there's not a lot of reason to call us, which is where we pivoted. And now we're looking at enhancing and increasing the services that are available, like working with the volunteer driver programs to increase the services that they can offer. Yes.
And it was also really important, it was intentional, you know, phased this, because we didn't want to get out ahead of ourselves and get a whole bunch of phone calls that we didn't have staff and we didn't have anything to offer. And so we did months and months and months of this soft approach, doing very directed conversations before we go with some big, broad marketing campaign.
Sarah, please jump in here.
Okay.
Feel free to add to the conversation.
I just wanted to say, like, the aging service coordinators that work at JAVA also are, you know, reasonably knowledgeable about the transportation options in Charlottesville for sure, and in some of the counties. And so as they got used to me being there, I think they answered a lot of questions on their own. And we're doing that previously as well. If they were working with somebody on something else and then those people had questions about transportation as well, then they would just answer them or help them as best they could. And recently they start bringing those calls to me or transferring them to me or referring me or whatever. But in the beginning, that wasn't happening as much because it's very easy for them to just answer the question if they can. So there's probably some calls or some transportation things that they dealt with that we didn't record because they never made it to me.
Yeah, for the folks who were not able to be served, can you talk a little bit more about what that gap was? What were they looking for that we couldn't?
I'm gonna let Sarah answer that.
Okay, yeah, so it's various things. Sometimes the majority of people that couldn't be served lived in the surrounding counties outside of Albemarle in Charlottesville. And it might be because, you know, they have a medical appointment and so I don't know a whole lot about insurance. I just have to put that qualifier in there, but a little bit that I've picked up from working at JAVA and also, you know, in previous stuff that I've done. So I know that Medicaid does pay for transportation in a lot of cases, but it is, you know, there are conditions on that. And so oftentimes they couldn't get transportation paid for through their insurance. If they live in a county where JAUNT operates on, say, Monday, Wednesday, Friday, and their appointment is on a Tuesday, or, you know, in a different county it's Tuesday, Thursday, and their appointment's on a Wednesday, things like that, then that's not an option for them. And rescheduling their appointments these days is also very difficult. I've had people tell me if they reschedule, they're looking at, you know, sometime next year. And to get round trip to a doctor's appointment and back, even if you just live in, say, southern Albemarle or someplace that's not all that far away, it's still upwards of $90 per round trip thing. And most of our, I'm sorry, with some of these paid transportation services. So there's non-emergency medical transportation. There's a lot of them that go through Motive Care, which is the Medicaid one. But then there's some private ones. One's called Reliable Rides. There's another one called Brittany's Transport. There's one called Premier.
But there's not just like
taxis and Ubers. There's not
like
just
Uber and Lyft.
a lot of them won't go to the counties because it's too far away and it's not, there's nobody else for them to pick up out there, or it's too far for them to drive. They're only getting paid for whenever they drive the person back in, not for the trip out to Louisa, for example. So a lot of people aren't willing to do it. And so that's a big thing. The paid transportation companies that we refer to also have surcharges based on distance, based on time, things like that. So that's always an obstacle. Another thing that happens sometimes is, it might be someone who does normally drive themselves, but they're going to a procedure where they're going to be sedated and they don't have anybody else who can drive them. They're not allowed to drive themselves. They're not allowed to leave and take JAUNT. They're not allowed to leave and take CAT. They're not allowed to leave and take Uber. So there has to be somebody who will wait there with them and be responsible for them when they're discharged. And so that's also very difficult to find. And again, some of these paid non-emergency medical transportation companies, they will do that, but it's very expensive because you're paying at least $50 per hour for the wait time. You're paying for the trip. You're all of these things, and so that's difficult. Occasionally people would not. I couldn't find something for them because they would call me about an appointment that was the next day, and there was just no way to find something. But chances are good that if they were in the same situation as these other people that have called that I couldn't help, that I wouldn't have been able to help them even had I had a longer period of time. Yeah, I don't know. Did that answer your question? I think it probably.
I was thinking about when my mom became a non-driver, one of the things, and she's also never good at technology, even in her prime. She would call me, tell me where she was. I would call her an Uber, and then she'd be able to go her way, and that's how we problem solved. So I was just trying to figure out. She was often going from the city back to the county where my parents' house is, and so there were plenty of Ubers and Lyfts in the city going in that direction. So I was trying to figure out what is preventing kind of that on a larger scale. And yeah, people are left out Louisa and further afield. That does make that.
I think it's more availability is one problem, is when you're dealing with Uber and Lyft and taxis and whatnot. But I'd say probably often they would be willing to go, but the person cannot afford it because it just gets so expensive once you add that
so I'm
distance.
thinking about like all the money we're spending on various programs. Like, what if there was just kind of a fund
that helps pay for that? So that's one thing that would definitely help, and that's one thing that one of the things that we're working on. I'm sorry, just tell me to be quiet. That's one of the things that we just are working on doing, is having a fund that we can use to reimburse people or to pay for those transportation things. But so, for example, I had one person in Nelson County who had to go to dialysis 4 times a week. And there wouldn't be a fund big enough to pay for that for him. Whenever we start this, we're hoping that it's going to be a last resort whenever people can't find anything else. And it's probably only going to be able to serve a couple people a month, at least at the beginning, unless, eventually maybe we could grow that to be bigger. But it's, that would be hard to keep that sustainable because it would just require so much money. So I think if we can, work in the counties to grow volunteer driving organizations or things like that, that's probably, and then we can hopefully, if people are donating their time and we're able to help them with insurance and gas money, then that's a much more manageable expense that we can help with.
Katie Miller had a question. I don't know if you still do, Katie.
Yeah, I mean, I think you kind of touched on it. I was just gonna kind of clarify on that payment gap being part of it, of understanding that was my understanding that, moving forward, using some of that 5310 funding to be able to provide like vouchers or subsidized rides or free rides for seniors and individuals with disabilities who qualify. So that would hopefully, be able to help close that gap in some cases.
But this is how we got involved with this, which might have been before you were even on RTP, which is that the UVA had spent in 2022 $500,000 unbudgeted to pay for rides, and they wanted to stop. They wanted to figure out a better system. They're using all the same providers that we do at PATH, and so the end result was that people were being left in the hospital because they could not get home. And we know that a lot of the insurance drivers will accept the ride and cancel it when they learn that it needs to go so far. So that this gap has existed for quite a while, and UVA has not figured out a way to solve it. And they have an Uber voucher package, but again, it's the distance problem that we're serving such a wide circumference of rural distance in that non-billable zone. So we realized that people were being readmitted to the hospital because they could not get a ride home. So that's when the kind of like Blue Ridge pathing came together. But there was not like, we're still running into that gap.
And I appreciate that this is a solution for the situation that we have now, and it's something that it's trying to meet our current moment, but it's also it's addressing a symptom, not reaching the root cause being that people are too far away. And the way to improve that is by building more closer so that people don't have a distance problem, so that it becomes it's not a transportation problem, it's a housing problem. And that's, I think, something that we also kind of need to keep an eye on, is there's affordable housing in the city, people can age in or move back to the city to live in, then they're gonna be closer to all of the providers, they're gonna be closer to activities that they wanna do, and so that's a broader thing to keep in mind, but something that I don't think we should lose sight of.
I would also suggest that we're talking about a regional transit authority now that would provide the money to connect rural counties, city, and I'm just saying that we need to keep some of this in mind as we're going through the process over the next couple of years.
I guess my question is, there are Medicaid and Medicare providers. Is that gap so large that you couldn't close the delta? Meaning you would also apply, because a JAUNT, for example, could submit the billing for the portion of the ride. But if the ride is going to be $100 and the voucher's only going to take care of 50, could you pay for the other 50 out of a different pot of money?
That is a question I don't know the answer to. I don't know enough about insurance. I do know, or have learned at least, that there is not, like in my ignorance, thought that there was Medicare and that there was Medicaid. But apparently there are dozens of providers of Medicaid and dozens of providers of Medicare, and none of it is the same. And half the time the people with the insurance don't know what they have. And so that's a problem. Medicaid will provide a good number of rides for people per year, right? Medicare is much fewer. I think it was maybe 24, 48, and they're not counting that as 48 round trip, that's each direction. So that becomes a problem, and a lot of people don't have it. But I don't know if they would do a sort of a hybrid payment sort of system, or how that would work.
So and this is for a different conversation for later, but in Richmond, there was this was 15, 20 years ago, they were doing Medicaid providers, and they were actually billing Medicaid so there was a voucher, they have to sign off, the doctors have to sign off.
Oh, interesting.
To make it happen.
Yeah, that would be cool.
But there was still a delta, and there was a concern about how to get the delta paid. There was no pot, so eventually, I don't know whether Richmond didn't continue that process. But in the rural areas, there may be a way for us to potentially.
That's a very interesting idea. So far, the majority of calls that I get are not people who have Medicaid. They almost always only have Medicare, or they have the hybrid Medicare-Medicaid thing, which is not very good on coverage for transportation, apparently. When I used to work with people with disabilities and I had to arrange their transportation, Medicaid was wonderful, but that was not for medical appointments generally. That was going to employment or day programs or things like that. And they got basically, a year's worth of everyday rides Monday through Friday without any difficulty. But those people had, staff of whatever agency they're affiliated with to drive them to medical things. So, yeah, that hasn't been something that comes up very often. I haven't had a whole lot of calls from people who have disabilities but are not older adults. Almost everybody I've had is on Medicare or both. So.
Jason,
Yeah.
or Mike is your tag set. Or Mike Murphy is your tag.
Mike. Thank you for this presentation, it was good. I know a lot about PATH, I wish Mike had seen it, I'll make sure it gets in front of him. We have been working together, Lucinda, with DRPT, and Mike, we've been having conversations of how to, bridge these gaps and how we could, what's allowable, what's not, and so we're working on solutions, we're getting there. Just know that that's happening in the background. It's interesting, your medical trips, what do you say, 75% or something of people calling in?
84, I think.
Right. So I think that's indicative of the people who are finding you. Because like when I look at the trip purpose that we do for demand response in ADA and the whole rural area, medical trips, I could even share these with you, I think all these pie charts. But like medical is only 25%, employment 31, social is 30. So it's a little more balanced in terms of what people's needs are. But it's just a reflection of like who's calling you and how it compares to like the actuals that we're getting and providing that service. It's interesting when you go through jurisdictions, it's usually about the same. Albemarle's about the same, Charlottesville's about the same. It says when you get out to Nevada, it's like 52% employment. There's more people coming in for work. And the same with Green. Again, a lot of social, and you get over to Louisa, pretty balanced. Then you get to Nelson, and it's 65% social. So it's like, it speaks to the different need, which I really liked, which you didn't present. You had in there the findings from the survey. And I like the insights that you had there because it speaks to the pain points that people are feeling when they're trying to use or navigate transportation. What I like about that is you interview people, right? We recently did a rural transit needs assessment study. You will get a presentation from it. I don't want to steal the thunder from that. Mike's going to be able to give that to you sometime.
It's going to be our meeting in December.
Right. Good study, very academic. What I like about this is it was talk to actual people. And there were stakeholders in the rural transit needs assessment, but those stakeholders were mostly like us in the room here, right?
Not actual users.
Elected officials, agency folks, staff. Whereas that's why this is a nice complement to that, because it illuminates some pain points and some insights that those two documents together might provide a good platform for thinking about making decisions and investments in the future.
So Jason has a really good idea. When we have that December discussion, let's have this at the table as well, not to necessarily show it again, but just to remind folks that, because we do have people that are missing out on this today, and to connect the two. I think that's a real good idea. I was part of that survey, and you're right, it was mostly electeds and folks that were not actually users.
I think Dr. Jeremy made a good, very academic, numbers-based argument about the need, right?
Right.
Useful and good, but I like this, because the two together, I think, complement each other.
But I do feel like I need to make sure that we connect this as we're going forward to our regional transit authority and figuring out how we're going to move transit out into the rural areas. Because Nelson, for example, in Ann and Ben's work, reaching out to the rural areas. For example, Nelson was very interested in the authority and being a part of it because of the need. Some of the other counties had different positions, weights and sees and all, but this all speaks to the need in the rural areas for people to have transportation into doctor's offices or wherever, right?
I think one thing to really look at too that we didn't notice until we kind of started working together, which we noticed in medical care providers on the health side of things, but it was reflected in transportation, is that proportionately we have enough providers, but we don't have enough providers who will complete a ride.
Yeah.
So it's good to kind of peel back and look at that deeper, like, oh yeah, you have 72 like Barbies, whatever, transport, will do medical transport, but they still aren't picking up enough people and completing those rides to the county. And so it's the same thing we have with dentists. Proportionally, we have plenty of dentists in Charlottesville, Albemarle, according to DMAS and Medicaid, but those dentists aren't taking new patients. So it doesn't do us any good. Right, so it's that same, like, just be careful when we look at that stuff, that we have Medicaid options, but not enough Medicaid drivers who will follow through. And so that's why PATH is so helpful in another way, because the direct call and the see it to the end is really helpful versus just sitting there and, taking a crapshoot that it's gonna happen,
So we really need to remember, and I'm gonna say, Christine, we need to remember as we're talking about the Regional Transit Authority and setting it up and the users and how this all needs to be part of that discussion and figuring out how we reach out to the rural areas and make all of this work.
I think commuting is really important too. That gets the cars out of Charlottesville, and off the interstate, and
reduces the number of cars.
Yeah.
Because the reality is that there are people that live in the rural areas and they want to live in those rural areas.
Exactly. We're not gonna, that's what I just said to Garland.
Exactly.
I want to live out there.
And to be honest with you, I mean, I get it. We talk all the time about we want our firefighters and our police officers to live where they work. I've talked to many firefighters and police officers over the years, and sometimes they want to live where they don't work because it's nice for them to be able to go to the grocery store and not be caught by, I'm just saying. So we have to really recognize that just because it seems like it's what everybody, that's not necessarily.
I was going to note that after Councilor Oshman said that, is we have to be very mindful of the fact that yes, this isn't affordable housing, but there are also people who by choice want to live in the rural areas and don't want to have to live in an urban area in order to access medical services.
Their family is in the rural area, they have roots in the community, or for example, the police officers want to live where they don't work.
I think the other benefit, I think the other benefit of mobility management, the PATH program though, is so many of these situations are very individual. We might have a solution that'll cover 80% of them, but there's some of these, it's one person who needs stretcher service, exorbitantly expensive, and you have to work with that person to try to figure it out. Or, I read through the notes of the callers just for my own curiosity, and there are times when people, there are options, they just will not elect to take them.
Yeah.
So they're within the microcat zone, but they don't want microcat. They don't want to do it. They want to do it a different way.
Yeah.
So it takes really working with each individual issue to try to come up with what is a solution.
But all good things to think about as we're establishing the authority, reaching out to the rural areas, trying to figure out how we can get this connectivity, don't you think? As well as the funding to pay for it.
Yeah, so looking at the bigger picture, I would really like to get a bunch of partners together from UVA Health, Centera, maybe the Ridge Health District, and John and Pat, the service providers, and try to come up with a big picture way of addressing those needs in the rural areas and in the urban areas for medical transportation. But in the meantime, we're just kind of Band-Aid piecing along.
And so you have grant funding still, how much longer will that last?
Yeah, so we have, thanks to DRPT, we have next year's funding, which will start in October, and it'll go for a year. And we will be applying for fiscal year 2026 funding in January. So right now we're looking at partners, because one of the great things about the 5310 program is that we can help support transportation services. So we're looking for partners who will expand the services available and meet some of those needs that we're seeing. We're really talking a lot with JAUNT and DRPT, because I don't want to silo everything and have like little Band-Aids everywhere. I'd much rather work with an established service provider who's providing those services already and just help increase them to meet the needs that we're seeing. So we've been kind of looking at big picture stuff. We're also working on the little stuff. Yeah, so I want to invite you all to our bus field trip. It's at Innovage, and we are doing a presentation training from 10 to 10:30, and I'll send out an email with the full schedule. You can drop in at any time of the workshop.
Great, thank you, Lucinda, and thank you very much. This has been really
You're
great.
welcome, thank you.
Katie, do you want to add anything just on behalf of DRPT to this discussion? I saw you nodding your head a couple of times.
Yeah, I mean, we have, as everyone has kind of mentioned, some ongoing conversations with JAUNT and with TJPDC about kind of how we can fill some of these gaps using 5310, how that can combine with the existing service and kind of what we can do, because it's definitely an important project to be working on.
So short-term and mid-term and long-term goals, as many issues, you have to have solutions that are appropriate for the timing. I will say though that just as in our community of Charlottesville and Albemarle, when we have all these transit providers running around between UTS and CAT and 2 public school systems, I mean, it just, in JAUNT, that's a lot of people trying to provide services, and we still have a need. And when you talk about all of those services that are now around, I am shocked, because that's a lot of transit providers not providing the services that we really need and the need in the community. I mean, it's really, it's amazing. And I'm not talking specifically about CAT. But I'm just saying that really there's a need, and we've got to figure this out.
If I can just say one more thing, maybe 2 more things, partly about what Jason was talking about, but I think that the callers that we get, and this might account for the low number of calls as well, is that people call us as a last resort when they've tried calling JAUNT and tried calling CAT or tried using these other services and it didn't work, and they're like, what can I do now? And so they call CAT. And I think that accounts for a lot of the reason why the majority of our calls are looking for medical services, is because those aren't optional, whereas something social or even work might be more optional. You can change your schedule at work, maybe if you have a supervisor who's cooperative, or you can elect not to go to something social, or you're likely to have family members going with you to something social that can maybe drive you if you can't take JAUNT or CAT. So these are the people calling that just couldn't figure out anything else on their own, couldn't figure out anything with the help of family, and that's also why there's such a large number of people that I couldn't help. And so I think that's a big thing. And
Seems medical trips are a little more complicated because of the times, and then when you get discharged, or like,
yes.
people can schedule rides with shots, but sometimes you don't know.
Exactly.
Discharged, and
Exactly.
that's more of an on-demand service, which is more like a drive and
MicroCart works wonderfully for that, but currently only in those 2 areas, not inside of Charlottesville or in the surrounding counties. And yeah, that was another thing, like the people who from the counties who sometimes didn't want to use JAUNT, even if it was available, would be because they're going to a medical appointment, and so they're already not feeling well, likely. And there might be a 4-hour gap between when they can arrive in Charlottesville and when they can return home to Greene or Louisa or whatever. And, they're 84 years old and not feeling well, so they're not feeling like sitting there in their doctor's office for that long. And so it makes it, although it's there and it's available, it's not a viable option for that individual circumstance, maybe. And so that is something that I encounter fairly frequently. And the lady I think that you're referring to, who just didn't want to take MicroCat to her doctor's appointment, I couldn't understand that, but you know, it is what it is. Somebody told her, you know, some friend of hers told her that she would have to wait forever, and I tried to tell her that probably wasn't true. But, you know.
So that brings me back to microcap, Carla. So a decision will be made about microcap, is it next summer?
Decision, a
Well,
little bit more.
it was a 2-year study.
Correct.
It's on file for 2 years.
Correct.
And it's only in certain areas now, Marquette, right now.
Correct.
But when we approved it and agreed to the funding,
Correct.
we said it would come back to the supervisors at some point, and then we would determine whether we're gonna continue it or how it might change.
So I think that'll be a part of your discussions this,
Budget
budget
cycle. Yeah, so this spring, so that, because I'm assuming that pilot ends probably July 1.
So we are going to sign the second year of the contract in October, we're coming up. And then that'll start the clock,
Oh, so it's October. Okay. All right, so that'll be a really good discussion, because at that point, we will be able to discuss whether or not we want microcap to go into the city, right? How we want that to play out, because there are lots of other options. Where we are serving folks right now is just a pilot.
Correct. So there have been discussions about potentially this becoming more of a regional approach. But that's the conversation that the two legislative bodies will have. And then you potentially could go back to the state and look at a different trips grant to make that potential project happen. But it's it's a decision that happens at the trip.
But I could see microcap, if we can expand it into the city, and expand it in Albemarle, could help solve some of this problem.
It's gonna take care of the portions for Albemarle and the city.
Yeah.
It's not
Not
gonna
the
take care of
rural.
anything for Louisa, rural.
And I understand that, but at least when we're talking about timing and trying to get something up, that's gonna happen quicker than perhaps the authority. I'm just saying, perhaps.
So I would caution everyone, as I said, microcap works wonderful in the county because you have made sure that it is in 2 areas. It's not the full county, it's the urban aspect. If you pull that model into the city, the resources are going to be stretched pretty quickly because we would potentially talk about a larger portion of the city that are going to command a whole lot more trips pretty quickly. So we were very aware of that, and we've had conversations with VIA about that, so that we have, I believe, a couple of scenarios we've looked with them for what it potentially would cost to make that model happen. But I would say it's a pretty conservative ridership estimate in the model right now. And like I told the board of supervisors, we're gonna blow those numbers out of the water, which we did with Cat in the county, because we're way above where we thought it would be. So that's caution everybody about that. The model's gonna be a whole heck of a lot more riders as soon as we turn, if we turn it on in the city that we take.
But it is serving our constituents, and they are really using it.
Yes, absolutely. And the more they know about it, the more we start advertising, we are seeing our numbers spike.
Jason?
Yeah, we're finishing up a microtransit study, which will bring to you as well. And it's looked at some of the things. I mean, if you build it, people love it, and all of a sudden there's demand, that becomes a cycle where then, okay, now I gotta meet that demand. How do I do that with my existing set of resources, which, anyway. It also could produce more efficiencies, and it could work in some rural areas like, like Crozet, like a catchment area, around an activity center, or like even green around Rutgersville Center, which we looked at. But taking people from a rural area, driving all the way to the urbanized area, microtransit's not done. But I always tell you, people, technology for microtransit is like it's like a robot. It goes around within a certain area and services people like Uber or something. It works really, it's more localized.
That makes sense. And that's a good caution.
A lot of places are using it like first mile, last mile connections.
Yeah.
Connective
Which
to
makes it work
fixed
really
route.
well. You gotta keep the area pretty tight because then you're potentially supplanting with the micro transit or on-demand services for your fixed route, where you can have a huge demand for the micro product. And now people are, overwhelmed in that model where you're thinking you need, 30 drivers to do the model, now you're gonna need 50, 60 drivers just to do that model. And then you still have the fixed route services still need to go on because not everybody is gonna use or wants to use on-demand service.
Looking at the time, good discussion.
Can I, I'm sorry.
Yes.
Go ahead.
When we talk about choice of where people live, of course, there's going to be folks who prefer a county rural lifestyle. This is not discounting those, nor is it entirely about those kinds of folks. This is about the people who are on the phone with you because they are already struggling. They can't afford to get somewhere on their own. They maybe don't have that family support, as evidenced by the fact that there's no family there to take them to where they need to go. And perhaps, and the people that I'm thinking of when I made my earlier comment, they're forced to live somewhere more affordable because that's where the affordability is. And that makes it harder for them in other aspects of their life if they can't get around, if they don't have that family connection. So providing additional housing in the city to make it an option to be closer where they need to be, that's who I'm talking about. It's not everybody and trying to force everybody into the city. I hope that was clear. Obviously, there's going to be people who are able to have a more rural lifestyle or who maybe age out of the ability to have a rural lifestyle, and they should have the option to move somewhere that's more accessible for them.
Yeah, and we don't disagree. We just were saying that there are folks that make different choices. All right, so Lucinda, thank you very much, and thank you very much for
You're
joining us.
welcome.
This was great.
And can I just say too, one last quick thing,
Sure.
is that all of the feedback, or nearly all of the feedback that I get about especially MicroCat and JAUNT, because the majority of my callers aren't using regular CAT just because they're, right, or because they have a disability and they're using JAUNT already, but number one, JAUNT is so easy to use, and people don't call me because they don't need to if they're already set up with JAUNT, at least in Charlottesville, Albemarle, and all the feedback that I get is really, really good about both of those programs specifically, so I just want to put that out there.
Thank you.
You're welcome. Thank you.
All right, so I think Lucinda, your presentation. So we're ready to move on to the transit provider updates. Albemarle County Public Schools, I don't think anyone is here from Albemarle County Public Schools, so we'll move on to Scott from University.
All right, I have two items to share. The first one is, if you remember, gosh, I've been here a little over a year now, and I think it was the first, maybe the second meeting I was here where Patrick Clark from my department came and presented on the Commute Club initiative. It was a presidential, or Office of the President award that he had won with someone from the Office of Sustainability, and it was a incentive program to get folks to try alternative commuting patterns. So we have been working really, really hard for the last year, and we have officially launched on Monday. So what was called Commute Club, maybe when this body last heard that presentation, is now Wahoo Commute. And so we launched on Monday, and so it basically, I'll just recap because I know it's been a year, if you don't recall, it incentivizes not taking your single occupant vehicle to grounds. So we are literally paying people to bike, to walk, to scooter, to use public transportation, to carpool, and to vanpool to get to grounds. So it's, if you're familiar with Who's Well, which is sort of another similar program that rewards you to exercise and to see your doctor once a year with an actual financial incentive, the Wahoo Commute Club will basically work the exact same way. So it is directly tied, it's just for faculty and staff, I should say, it doesn't apply to students, unfortunately. But the reality is, when you look at our mode split, every 3 years we look at how folks move around the university and come to the university, and the faculty staff, we're the ones that drive SOBs. The students, 90% of them walk and bike and bus to get around, but it's the workers who take the cars. And so anyway, it launched Monday, And it's tied in, you have to log in with your university ID, and it's got a commute calendar. It's very, it uses the platform is Loom, L-U-U-M. But if you go to our parking.virginia.edu, you'll see right now we've got a big banner that says Waga Commute on there and has some information about it. So we're very excited. So just since Monday, we've had 2 people already. Oh, I should probably say a few more things. So basically you could get paid approximately, if you did it every day, if you did one of the if you don't bring a car, so you're biking, walking, riding transit, you could get $1.50 per day. So that directly goes into your income, your paycheck,
Yeah.
right? And so $350 a year roughly is the max that you get. But given that that's also about the cost of our cheapest parking option, it sort of swings the needle, if you will, 180 the other way. So we know that we're at first going to be paying people that we're doing this anyway, but we're also excited to see, because we didn't have any information really other than, people occasionally saying, hey, could you have a bike rack here? Or hey, there's, this need. Now we're actually, it's also, I should say, it's gamified. So there's a leaderboard, so people can record, you log in, you voluntarily log in where you're riding from. So it's tracking your miles, it's tracking your greenhouse gas emissions, savings, and everything. So it's all in the dashboard. So it's pretty exciting. We just launched Monday, and like I said, 90 some odd people have signed up already. We do make a requirement to get more than sort of a sampling of the benefit. You actually have to commit to either not having a permit or literally turning your parking permit in.
Oh, okay.
So so far we've had 2 people do that. So that's we're starting somewhere.
So what area? Is it only in the city?
It's how, well, actually I forgot one of the benefits. I should have looked at my notes.
So I'm wondering
The
if
other
I
thing that we
have to-
added, the other thing that we added was, we had been subsidizing partly Afton Express. We've now made that completely free. So you just show your UVA ID as of Monday, just show your UVA ID, and you can ride from Stanton to Grounds for free, plus get $1.50.
And Light Express has been very popular.
Yes.
I understand you're adding another vehicle.
Yes.
Which is wonderful.
Mhm.
Just wonderful.
So,
And the raffle.
oh, thank you,
Yeah.
thank you. I forgot the raffle.
The
Thank
raffle.
you. So there's the incentives, and then based on the number of times you participate is basically throwing your name into the hat, if you will. So we're randomly drawing out once per year, I think is the max you can win, but up to $500.
Wow.
So, and then we're also putting in an incentive to, after you've done X number of bike trips, you could get a discount on an e-bike. So lots of incentives.
So if I'm an employee or faculty at the university, where do I have to live to be able to access this?
Anywhere. I mean, I'm sorry. You do have to be Charlottesville,
In the city of Charlottesville?
Well, no, you have to be UVA proper. You can't, but we have HR employees who live in Chicago, for example, that are 100%
Okay,
commission.
so it's not
There's no way for
just-
them to
it's
claim
not-
any benefit,
Yeah, but
right?
I'm just saying.
But yeah, if you come to Grounds
Right.
here in Charlottesville, whether you're coming from Stanton, Fredericksburg,
Okay,
wherever.
that's what I was
Kendall is making out with his van pool from Short Pump. He's on the leaderboard. I think he's in the top 15 of transit users. So yeah.
That's cool.
It's like I said, it's pretty
That's
cool. We just launched. We were kind of keeping it, I would say quiet, because people know about it, but we haven't like completely done a press release or anything. That'll come in the coming weeks to make sure. We did a lot of testing to make sure, because we have a little bit of complications. The health system gets paid one week, the academic side gets paid the opposite week, and so there were a lot of things we had to look into the background to make sure it was working.
So you're having a soft opening?
Yeah, it's an official launch. It is open to any UVA employee.
That's great.
Yeah, Jason?
Yeah, our Connect services, which are rural commute services, which is Crozet, Buckingham, Livingston, and 29 North. The largest on-off stops are UVA.
UVA, correct.
So there's potential to do a little outreach there and say, hey, look, want to take advantage of this program? Well, that's a big challenge, is letting people know that the service is there.
Right. So it's incentivizing what we want them to do, which is not going to be harder.
That's really cool.
So that was my one big, and any other questions on that? So yeah, and it did also change our carpool program a little bit. Basically, the benefit now comes in the discount that you get from sharing the cost of the permit, but you still buy the permit. We used to have it that the more people you had, you got a bigger discount. But now we're having the full price of the permit being paid, but it just depends on how many folks are joining your carpool as to how you're splitting it basically. But, yeah.
This is about actually something you mentioned last time. You had ordered the small e-Just.
That's number 2.
Okay, I was just wondering what was up with those. Okay.
Yeah, so any other questions on Wildwood Commute? Like I said, so it just launched Monday. We have about 90 people doing it already. I'm excited. So
Yeah, very
we'll see.
excited.
I think, I don't know when the right time frame is, but I'd be happy to either bring Patrick back in or you to update myself with some more statistics and numbers and things.
When you think the time is right, just let Lucinda know, we'll put you on the agenda for that, that'd be great.
So that was the first thing I had, and then the second one is, I think at the last, I whetted everyone's appetite by saying that we were strongly leaning towards a purchase. We've now made the purchase. The purchase order has been released for 5 of those e-Jests, Carson e-Jests, and good news is they will, hopefully, so they say, be here by the end of this academic year. So it's not like our big transit buses, which have a little bit longer lead time. So we are hopeful, we're really hoping to get them into our off-peak hours, midday services, maybe our night pilot, really kind of introduce them in spring semester. But I will give updates as we go.
Very exciting.
And so these are the ones that will go under the railroad.
They will fit on, that's right, they will fit under the railroad.
Or Old Valley Road.
That's
Those are
exactly.
exciting. Yeah, that's great.
Those are my only two.
Any other questions for Scott?
A little jealous of Scott that he doesn't have to worry about the 5 American positions.
That's correct.
5 people.
There you go. In his
And then donate them to the city, right?
Talk about that.
Let's speak of that, Garland, you're up next.
Okay, so couple things. We officially have our Assistant Director of Transit for Operations. Her name is Karen Davis. She comes from Williamsburg. We put a nice article in Mass Transit. So that went out at the end of Tuesday. She's coming from Williamsburg Transit. She's 10 years. The driver worked her way up into the operations assistant director there, which is the second position at Williamsburg Transit. She starts here on October the 7th, and I'll bring her to the next meeting to make sure everybody.
It's great, yeah.
And for those who are going on the.
I was gonna ask, is she coming to Illinois?
She'll be there. Yeah. All right. Other great news for us on the transit side is we were informed by Gillett that they had available space to move us up in production. Therefore, we're going to get in the production line and we were slated to get 8 diesel buses, 435 footers and 435 footers, 429 footers, which would have come January of 26. We're actually going to be able to get them in March of 25. So that is wonderful news. That speeds the process up a bit for us. So it gets 8 of the older vehicles that are causing us major maintenance issues out of the way.
But they're diesel.
They are diesel.
Yeah.
They are diesel.
I get it.
Yes, and we're working through, we had a very good meeting with our consultants to work through kind of the next planning and phasing of building out our infrastructure to support alternative fuel vehicles. That meeting, I think it went pretty well, as well as it probably could have gone. Big price tag for a lot of this. We're going to be going after a bunch of discretionary grants to close funding gaps for us. We're going to be working hand in hand. Fred Astaire and Ginger Rogers moved with the state, with Katie and the team, making sure that we get the application as tight as we possibly can. We're probably looking at $60 million of capital improvements that are needed to make this project happen. It's expensive.
Yeah.
And that includes both the battery electric and the hydrogen.
Okay.
So, That's on the transit side. On the pupil side of the house, things are going as well as we can expect there. We've got four potential more additional drivers that are in the loop. We're going to be starting a pretty aggressive marketing campaign that kicks off radio, TV, radio ads, TV ads, Facebook, October 1st. So you'll be seeing that around for trying to make sure we get as much advertising as we can. And I guess the last one is our service improvement, going back to training. Sorry, I should have said that before. Our service improvements will kick off October 27th or 26th, whatever that Saturday is, and it will have service to the center.
To the center, great, wow, that's good.
I'm so sorry Peter's not here to hear that himself.
So we just gotta get the contract.
Okay, I'm gonna tell him, I'm texting him right now.
Contract to allow us to come onto your property.
And we still need to figure out the ACRJ piece.
So that is phase 2.
2, okay.
Yeah, but we're close.
Okay.
We're close. So
Sounds good.
we're looking to put it into our service improvements for the spring/summer, which is May, June. So that would be splitting the two. So we have one that goes by and connects to PVCC, and that would connect to the jail.
To the jail, great, okay. One quick question. So you all are continuing to find success with your middle schoolers and high schoolers utilizing CAT buses?
That's correct.
That's great.
Yeah. So the
Are you tracking any numbers for that, Caroline, or you know?
we do not do that.
I mean, just numbers, yeah.
It's hard for us to track. So yes, it's on public transportation. It's either I track everybody or I can't track anybody. And we have gone back. There are ways that we can track people. We have fought hard not to do that. We could use, there are services out there that we can actually use your phone, we can track where you are. But the problem is it doesn't stop when you leave the bus.
Oh, okay.
So you would track you to your house. So we are not doing anything.
I'm just mentioning that because Champaign-Urbana is using that model, and so when the folks are visiting.
So they're using a tap card, so
Yeah.
that's how they're getting the students to.
But I'm saying the students are using their
Correct,
buses,
where
that's why.
we're going zero fare right now, so there's no incentive for anybody to do anything. But that's a conversation that we need to start having.
Right.
About whether we're gonna continue the zero fare model. If we do that, then I'm gonna be coming to Kate because our fare boxes are terrible. We're gonna need to upgrade. She's heard this bill before. We need to upgrade everything.
Has to happen.
There, so we're probably talking about at least $1 million to upgrade our technology to make sure that because we don't want to, when we upgrade the fare boxes, all the new technology and things that people want, that's what we're gonna have to go to the new generation, meaning mobile pay. So those are the sort of things that are really expensive. They don't sound like it, they are, and then we gotta have the back office support systems built in so that it's encrypted, so we don't want to steal your information. So that technology is pretty expensive to have.
But I'm just talking about, so when people are in Champaign-Urbana, looking at it and asking questions about how that model is working, because it does reduce the number of cars and trying to get folks.
I'm assuming that the school system, and I need to check with them, but I'm assuming the school system is probably somehow tracking some of the kids. How many kids are using part of that?
But we do ask the kids in the schools how they get to school, so we have, and it's very high tech, we go to their gym class. And we say, everybody who walks to school, raise their hand. So we have that sort of data, we have to give it to the state, our safe routes to school program, that's funded through pathway. So we know how many kids are riding the bus to school roughly, but it's also, you're asking really cool kids, did you ride the bus? And some of them think, school bus or, so there's a little bit confusing there.
We've got one 15-year-old riding the city bus to school. I can account for one. Ta-da!
That's right. And I know another one.
Oh, you know the two too, okay.
All right, so then, I'm your timekeeper here, I'm just looking. So, John is next. So
Yeah.
Jason.
Actually, we probably talked about most of this stuff already. We have a series of studies that are coming to to fruition that we'll be rolling out. We'll, I'm sure, generate some good conversation about just things like bus electrification and what we're doing and microtransit and all that. So some interesting findings from those. And then rural transit needs is in December. We have one little just service update. We are on Monday, September 30th, implementing a slight modification to the Buckingham Connect route. There was it is pretty much we're trimming the ends. There was no ridership at those stops. And we were driving out to Duck's store. And everybody had another 15 minutes, it was just a waste of money. So we are trimming it, and I think 29 or some TV stations messaged that we're reducing, so it sounded like we're cutting. All we're doing is modifying a route to be more efficient, so messaging sometimes gets lost.
Because my understanding is that Buckingham convenience stores has been very popular.
Yes,
All
it
portions
has
of
been.
it. Yeah.
And a lot of them get off of UVA.
Yeah.
It's basically, I'm sure there's people in Buckingham who don't know about it.
Yeah.
There's probably people in Rosé who don't.
Yeah.
So, but people who take the Connect services, we've heard they really love them. For getting to work. And they're designed for employment. In terms of bringing people in the morning and taking them back out in the afternoon. Could they be longer service? Always. It's just a resource.
But I know that you accommodate the shifts as best you can, the university and,
Yeah, to your point, one of the things that we added with the Wahoo commute was a new position dedicated to transportation, matching. So a person, hey, what's this Connect bus all about? It's a person who can actually talk to them about it, and explain, hey, here's a stop on grounds, these are the 4 trips in the morning, and 4 times in the afternoon, kind of help them understand, because that's the key thing. So people, first-time users are a little bit like, I want to do it, but I'm a little bit afraid, what if it goes wrong?
and they don't want to get stuck.
Right.
Yeah.
Legitimate resource, yeah. So that's it.
All right, let me just ask Katie, I think you're up, the RPT?
Yeah, no, I wouldn't say any huge updates on the DRPT side. I will just, feel like someone on the DRPT team has been up in the Charlottesville area a lot recently. There's a lot of exciting stuff going on, and we're always here as a resource. Technical assistance, or if we can help fill some of those gaps with state funding, we're going after federal funding as well. That's what we're here for.
All right, thank you. Anyone have any questions, just to make sure for Katie or for Jason? Their reports or all right, staff updates. Lucinda.
I have just a quick update. September 30th through October 6th is Week Without Driving Week. It's through America Walks, and they do a promotion every year nationwide, asking people to consider not driving for the week, and that could include carpooling or getting rides, and you can drive if you have to. They just want to bring awareness to people who can't drive and the difficulties that they face with everyday living.
So they'll be advertising that sometime, or there'll be some.
So we're not advertising it this year, but we're looking at next year maybe promoting it. Yeah, but I'm promoting it right now.
Okay. All right. I don't have any other business. I don't know if anyone else does. I want to just remind everybody there is no meeting in October because of the trip to Champaign-Urbana, and I think there's a conference as well, Christine.
Governor's housing, governor's transportation.
Someone,
When's that one?
So no
When is that?
meeting for us
Same
in
time.
October. Yeah.
Sorry, we were just both confused. Yes, same time, same conference, yeah.
So, and we all hope we have a wonderful trip. I wish I could go back. It was so informative. I love to go back. Having said that. All right, so our next meeting then, I'm going to adjourn us, hearing no objections.
Oh, I got one.
Oh, sure.
Luke DeVille has been rescheduled,
Yes,
so October 6th now.
Sunday, October 6th.
So,
No, an email has been sent out about that.
but all of it is just moved. So I think our park walk, that's moved to the 6th, the old, and also
26th. Any other? All right, with that then, I will adjourn us to our next meeting, which will be December the 12th, which sounds like a long time away, but remember, because of Thanksgiving and Christmas, we split the difference. And so we have a meeting on December the 12th, rather than November, December meetings. And with that, we're adjourned. Thank you, folks. Great discussion.